Committee on Healthcare hearing will come to order. Alzheimer's is in a category of its own in terms of its breadth, its lethality, the severity of this disease. We estimate 5.2 million Americans with Alzheimer's. It's 100% fatal. It's the sixth leading cause of death, and the number of fatalities is likely to be underreported. There's no cure. There's not even a treatment. The cause is still unknown. The toll on the lives lost, of course, is devastating, but the financial and emotional toll on caregivers is devastating as well, and there is a huge financial burden that the public pays. Research by the Alzheimer's Association concluded that Alzheimer's disease is the costliest chronic condition in America, more expensive than any other disease. Medicare and Medicaid together will spend over $160 billion a year. And while approximately 10% of Medicare beneficiaries have Alzheimer's, they consume about 20% of all Medicare dollars. The significant cost to Medicaid, as well as Medicaid provides long-term institutional care. And about half of nursing home residents have some form of dementia, many of them, of course, from Alzheimer's. For many of us, this issue is very personal. My father was diagnosed 4 years ago. I have a grandmother who died of the disease. I can say firsthand how devastating it is to families. I have been pleased to be able to work with a great bipartisan group of senators and House members on advancing a federal response to this. I'm the co-chair of the Bipartisan Congressional Task Force on Alzheimer's disease with Senators Markey, Collins, and Warner. And I've convened this hearing to explore further ways to strengthen Medicare and Medicaid, and especially to support caregivers. There's four big topics that I hope we'll be able to pursue in some detail today. First is the fact that a lack of diagnosis hurts families. There's a report by the Alzheimer's Association suggests that only about 45% of people with Alzheimer's disease or their caregivers are told of their diagnosis by their doctor. We need to ensure that physicians are aware of the value in communicating a diagnosis to the families. There are incredible advances in medical imaging technology now allow a definitive diagnosis to be made prior to death. In 2013, Senator Hatch led several members of this committee, including myself, in writing to CMS in support of a national study on using PET imaging to diagnose Alzheimer's. CMS agreed, and we'll hear today how that technology has helped families with loved ones who have Alzheimer's disease. Second point that I want to address today is the importance of caregivers being fully engaged in the treatment plan. Caregivers face tremendous stress, and a care planning session can help connect the caregiver and the patient with resources and support. CMS has proposed a new billing code for 2017 for a care planning session, similar to the approach that Senator Stabenow's Hope for Alzheimer's Act takes, and I'm pleased to announce today I will be a co-sponsor of your legislation. Third point is the huge long-term care costs for families. There are few viable long-term care options for many middle-class families, and it places a huge strain on caregivers as well as on family finances. Many families end up spending down their assets and eventually qualify for Medicaid. In 2010, Congress reduced the value of the medical expense deduction. That is the threshold above which medical expenses can be deducted. It was moved from 7.5% of income to 10% of income. I'm grateful to Senator Coates for working with me to restore that deductibility at the lower level. The IRS determined that 86% of taxpayers claiming this deduction for extraordinary medical expenses earn less than $100,000. This is an important deduction for them. I also hope we'll get a chance to talk about long-term care insurance. It can be enormously helpful, but very few people really have long-term care insurance. And finally, and maybe most importantly, we need a cure. 190 Alzheimer's drugs have been tried and they have failed in human trials. Companies have invested billions of dollars in searching for an effective treatment. The existing market for Alzheimer's drugs, about $3 billion a year is spent, but none of that money changes the course of this disease. And with the number of Alzheimer's patients projected to grow from over 5 million to nearly $14 million in the 14 million people in the foreseeable future, an effective therapy could yield enormous savings, most importantly, the immeasurable benefit of saving so many lives, but in addition, having huge financial benefit for those families that would otherwise be afflicted and for Medicare and Medicaid. There are other federal issues outside the Finance Committee's jurisdiction that I think need to be addressed. One is the NIH allocation. I have sat down and met with NIH Director Francis Collins. The NIH budget is about $32 billion a year. Alzheimer's research receives less than 3% of the funding. The fact is there are other non-fatal and treatable diseases that receive far more resources in their research. I think we need to increase our Alzheimer's research, and we need to do it in a fiscally responsible way. But I want to thank everyone for joining us today, including especially the Alzheimer's Association from the Delaware Valley chapter of the Southeastern Pennsylvania. I know you are very well represented here today. I appreciate that. And now let me recognize our ranking member, Senator Stabenow.